Welcome to Fox Soul's Black Report. This is the space where we bring you Black America's headline news, views, and opinions. I'm Romeo.
Hey there, I'm Brooke.
I'm Demi, and Niel is out today.
All right, coming up for you on today's show, we discuss safety while traveling and visiting your family and friends as the Omicron variant surges. Also, the president is doing something on his end. The administration hopes this helps. We'll tell you what should be easier to get for Americans. Also, federal judges, how many? And what does the group look like? The group of federal judges the president has appointed. We're breaking it down.
Plus, an earthquake rattles the Northern Californian coast. And we remember the life of Wanda Young, a singer from the Marvelettes who passed away this week.
Yes, we have all that and so much more. This is our voice and our truth. So let's get it.
Thank you for joining us this Tuesday. The coronavirus Omicron variant has taken over. It is now the most dominant strain of COVID-19 in the United States. This is a pretty rapid development. After just 3 weeks ago, you'll remember the Delta variant. 99% of cases, we were told, the Delta variant at that time was the most dominant variant. CNN's medical analyst says despite the dominance of the Omicron variant, we can still assess the risk before continuing to plan holiday gatherings. According to her report, it's still important to be careful when traveling through airports, train stations, recommending you wear an N95 or, much easier, to get a KN95 grade mask, and be aware of visiting medically vulnerable family members. She went on to say, quote, "I've equated the vaccine to a very good raincoat. It protects you very well if there's a drizzle, but if there's a constant thunderstorm, you could still get wet. When there is a lot of virus around us, as is the case for most communities across the United States, we need additional protection." You know, so we're going to talk about testing in a moment, but one thing that's been recommended and really important is that have everyone be that person. If you have to get together, obviously keep your group small, but have every single person take a test before you get together, because you don't want to be surprised that someone is carrying the virus and you don't know. And tests are widely available. It should be easy to get tested. Get a test and test everyone. Again, this is scary, but there's an easy way to at least try and make sure that everyone is as safe as possible. And also, if you take a test and it comes out negative, but you have one of the worst colds of your life, stay home.
Yeah, you definitely have to do that. And you think about what's going to happen. We knew this could be a possibility heading into the holiday season, right? On top of that, with New Year's Eve coming around the corner, we're hearing here in Los Angeles, there's one that's been switched to virtual now that was going to be open to the public. We're hearing that Vegas is going to continue to have their New Year's Eve festival going on. So it's going to be a lot of people there. So people are going to be traveling. So they're saying if you do have to travel for the holidays, if you could do it in the car, they would much prefer that. Because if you're going by plane, you're in the airport, you're close to people on the plane. And some people don't have on the mask, the high-end mask that you were speaking of. So it's so important that you do the right thing to protect yourself. If you are vaccinated, you still need to protect yourself, because what can happen to you, you could pass on to others.
And, just doubling down here, it only takes one person. All it takes is, even if you have a small gathering of 5 people, it only takes one person to infect everyone that can infect a larger group of people. It's like a domino effect, of course, as you know. And so President Joe Biden has said that if you are vaccinated, it should be okay to meet with your family over the holiday. But if you are unvaccinated, kind of back to what Brooke was saying, that it's more suggested just to stay home because unvaccinated people are at such high risk. Now, speaking of Joe Biden, he also said that he's going to give an announcement later on this week, but there are rumors, I'll say, that the Biden administration is actually going to reverse what they said earlier this week about pausing student loan debt, student loan payments. They were going to start back February 1st. They're saying now, because of the Omicron variant surging so much, that they might be reversing what they said. So there's going to be a lot of ripple effects as a result of the Omicron variant surging right now in the world.
And I will say this, I could have went and seen my mom for Christmas or for New Year's, but I chose to go the week before. It fell on her birthday, but there was less people in the airport, less people traveling. So I even thought about that. And you have to think about that too. Like, look, you may want to get away and go somewhere, but have a second thought, because you never know what you may bring back home to your family members, right? President Joe Biden agrees that the cancellation of holiday plans isn't necessary and has announced the purchase of 500 million at-home rapid COVID-19 tests and the plan to distribute them free to Americans who request them through a website, according to CNN. As hospitals become overburdened, again with the most recent variation of COVID-19, the country prepares to buckle down for a possibly troubling holiday season. It remains unclear how many tests any given household will be able to receive. The push for at-home tests is a welcome pivot from just last month when the president's press secretary, Jen Psaki, sarcastically dismissed the idea of sending free tests to the American people. It's worth noting that several other countries have already sent free tests out to their citizens, and for many of them, it has helped flatten the curve, and I think that is so necessary. Again, you think about the pandemic, when he got into office, President Biden, and still now, up to now, he had like a 54% approval rating, right? But as we continue to be caught up in this pandemic, it's going to go past 2 years, that number is going to go down. So right. Sometimes even what he suggests or the moves he makes now, people are not going to totally agree with it. But I do agree with this in-home testing because there are some places where the lines, it could take hours just to get tested right now, depending on what city, what state you're in. So some people kind of like get discouraged and they'll leave. And we don't want that. We'd rather you be at home. And then if you had both of your shots, if you had your booster and you don't have those type of symptoms, but you may still be positive, it's good to test at home so you don't go out in the streets with it.
So the only problem with this story here is that I actually went to a few CVS's last night to try to get in-home tests because I was like, I didn't even know that this was a thing. And so I heard that CVS sold them and they were sold out. But the only problem with the CVS, Walgreens in-home tests is that they're an antigen test. And so antigen test is a little bit different from when you do go stand in that line, Romeo, that you're saying you're typically getting a PCR test, which like if you go out of the country, they really recommend a PCR test because with an antigen test, the antigen tests only look for antigens, also known as proteins of the coronavirus, but different with the PCR test, they're pretty much looked at as the gold standard. That's why they have to go to a lab, and it takes a little bit more time to get the results back because it's a more in-depth and intense testing process that goes through when you take a PCR test. So the only problem is that when you do an antigen test, you have the opportunity to get some false negatives. Right, you could totally test negative and you think that you're okay, but the antigen tests don't get as deep of a strain and they don't pull out as much as a PCR test does. So the only thing is you'll be thinking that you're fine walking around thinking that you're negative and you really are infected and you really are infecting other people. So I love this. For people that are just at home, bedridden, can't really move around, maybe have disabilities, so they're not going anyway. But my worry is for the people that are like on the go, moving, still at work, still going to brunch at the weekend, still traveling. An antigen test, it's such a low level that it detects that you still might not get the result that you really are. And so that's my only fear with, putting 5 million of these out in the world and people think they're okay, but they're really not.
Yeah, I mean, they are okay. It's just there is a risk of like a false negative.
Yeah.
It's still a positive to get tested, especially since some people can't afford to go in and purchase a $25 test, right? But yeah, I've seen, just to back up what Demi said, that many doctors, I've seen doctors recommending especially if you're vaccinated, especially if you're boosted, to go get the lab test. Because of the fear of false negatives.
And people will get flu shots on a yearly basis, right? Does it really stop you from getting a cold?
No, it doesn't even completely stop you from getting the flu. It doesn't take away that risk. Yeah.
This is the conversation that I have with people sometimes. Well, people are still getting COVID even though they're getting the vaccine. I said, you're not understanding. It's going to lower the risk.
Right.
Maybe keep you out of hospital. Maybe save your life or your family member's life or your co-worker's life. So that's why you have to look at it that way. Look, this variant is going to be around. We don't know what the next one could be, if there's going to be one, but we have to be prepared for it, and we have to say we're going to go ahead and push through this and do the right thing.
President Biden is receiving praise for confirming more people into lifetime federal judgeships than several past presidents in their first year in office. Not only that, but the judicial court picks that he's put in place are also by far the most diverse mix of people put on the federal bench by any U.S. president, according to Huffington Post. Biden has confirmed 40 lifetime federal judges this year, 11 of which are appeals court judges, and the other 29 are district court judges. Of his 40 judges confirmed, 32 are women, 27 are people of color, 21 are women of color, and 27 have professionally diverse backgrounds, including public defenders, voting rights lawyers, as well as union organizers. So I always go back to Biden's very first week in office, and I'll never forget, we were doing our inauguration special, and I know Brooke is tired of me bringing this up, but I always bring it up. I always bring up the fact that I was like, Biden, you've done so much work, just have a rest. And I remember, Brooke, you were like, no, he needs to get, he was hitting the ground running on day one, and I was just like, let the man rest, like get a day off. But he hit the ground running on day one. Again, there are certain things that we feel with Biden. He could have done more, one being student loans. You guys know how I feel about that. But there are other things too, so many other things that we feel like Joe Biden could have done more, put more emphasis into. But we cannot deny that when it came to this, he hit the ground running on day one and has not took his foot off the gas. Just going back to some numbers here, Trump's judges were 85% white. Joe Biden's judges, President Joe Biden's judges, 70% people of color. Super night and day. And also, Trump had 8 federal judges. President Obama, 18. Trump had 18. Obama only had 12. So when we're thinking about Obama and what he did in his term, I mean, Joe Biden, he's making it known that he's really looking out and making sure that his cabinet is more diverse than any other president in the U.S. And so we have to applaud him for that.
Part of the struggles with the later part of Obama's presidency, former President Barack Obama's presidency, was that he didn't have control of Congress. Mm-hmm. And more than 100, there were more than 100 federal judgeships open that President Trump was able to, he had the opportunity to fill, former President Trump at the time. And part of that was because Republicans blocked almost every single nomination that President Obama at the time put forward. And now, when you talk about, okay, like what's being done, this is part of what's being done. They do have the power in these instances to push this through, and the power that wasn't there. I think there was a lot of focus on the Supreme Court nomination, right? The Supreme Court nomination. So what happened in the last term of Obama's presidency when there was a Supreme Court nomination? What happened there was also what happened with federal judgeships. That's what happened there. And also just the same as when Trump was in office, what happened with his Supreme Court nominees. That's the same thing that happened with his federal judgeships. And so we're seeing what happens when, at least to a certain extent, because the opposite is happening with Build Back Better, and obviously there are different barriers that you have to cross to get the president's agenda passed, put forward. But the federal judgeships, they have the power to get those nominees confirmed. Mm-hmm.
Yeah, and I agree with you, and I'm glad you mentioned the Build Back Better and also the voting rights bill. So the fact that those haven't got done yet, sometimes I feel like things like this that he's accomplished and done gets overshadowed.
Right.
Because people are sitting back saying, oh yeah, that's fine, and this is very important, so let's not take this for granted. Let's not take this lightly. What he got done is very important. How diverse it is very special. But a lot of people sitting back with their arms still folded saying, well, what about these other things? Because with the midterms coming up, with the 2024 election coming up, what if the House and Senate flips in the midterms? What kind of control are you going to have then? So people are still concerned, but we need to embrace this accomplishment.
Romeo, that's a great point. There are a lot of concerns, and I think that this was definitely something that was important to President Joe Biden. Him and Chuck Schumer, there are a lot of concerns, and people are wondering, like, what are they doing? What is VP Kamala Harris? What are they up to? They were working diligently but quietly on this project, making sure 70% of the cabinet was of people of color. But also, I saw a story today, I believe it was in Politico, that said Republicans are like, okay, President Joe Biden, it's been 1 year and you've made all these accomplishments, but are you going to be able to keep this up? Are you going to be able to continue this throughout your term and, pretty much go to war with Republicans over having such a diverse cabinet here? So we'll definitely be looking forward to see what happens in the coming years for sure with President Joe Biden in the cabinet.
And I'd like to go on record and say I feel like VP Harris is definitely behind the scenes making things happen. She doesn't always have to do something that's up front. And I feel like she's been caught up more than most vice presidents in the past. Maybe because she's a woman of color, and they want her to stand up for certain things that are not getting done just yet. But I feel like she's there. She's in the trenches, and she's part of this movement that's making it happen.
Can I also say, when we talk about, there is part of it, because, we've had this conversation before. When Trump was in office, he would say things that he was doing and going to get done that never even happened, right? But he was taking credit for them. He talked about the wall, and you would think that it actually happened, right? He was talking about who was going to pay for it, what was going to happen. He was always talking about what he was going to do. And President Biden is a little quieter, and so it makes the failures speak louder, right? But yeah, it's important that your president is telling you the truth. And also, when you think about, some of the things that are happening, it looks like nothing's happening. I wonder how much of that has to do with voters and the issues that they felt like were important to them. Obviously, for President Biden's base, his federal judgeship, his nominations to these benches, that's important. It's incredibly important. But people are focused on police reform. They're focused on voting rights, and they're not seeing that get done. And for many people, they feel like that's why they voted.
Yeah, I get it.
And so it's a multiple things. I like to say it's a both and situation, right? It's a both. People are frustrated because what they're most passionate about, they feel like it's not happening, and also because of what they're most passionate about, they feel like it's not happening. What is happening is being overshadowed.
Yeah, and I still think he's going to get a lot of slack and a lot of bad feedback due to the pandemic with the numbers surging once again. But remember, the blueprint was there before he got into office. Things could be quite different right now, quite different.
And did I say benches? Please forgive me.
All right, so mates, we have a story from Fox Chicago regarding the clinical trials for the COVID-19 vaccines. Take a look.
COVID-19 exposed weaknesses in our health system, namely disparities among people of color. One issue we've seen for decades, the lack of diversity in clinical trials. Chicago-based Abbott Labs is addressing the problems. Here to tell us how is Dr. Jennifer Jones-McMeans. She is Abbott's Divisional Vice President of Global Clinical Affairs. Glad to have you with us this morning. How are you?
Good. Happy to be here. Thank you for having me.
Absolutely. So let's get into this. What are the current racial disparities that exist in clinical trials, and why do underserved communities continue to face such health inequalities?
Well, at Abbott, we definitely believe that diversity and inclusion in clinical trials is essential. As we conduct our own trials, our goal is to ensure that the patients included in the trials are actually representative of those who have the highest disparity in these diseases. And so what we see is that currently among our clinical trials, and FDA actually just released a snapshot of this in 2020 among drug trials that had approved products, that people of color, when you think of African Americans, Latinos, Asians, were still under about 15% of the population of these trials that were used to approve current products. So we see still that D&I, when it comes to trials, there is a disparity.
So how can we create a more inclusive clinical trial ecosystem and address the disparity?
Well, one of the things that at Abbott that we are doing, and we've been very intentional about this, is putting the efforts into training the next generation of diverse physicians and nurses. So at Abbott, what we've done is we've donated $5 million over 5 years to support about 300 scholarships at historically Black colleges and universities that have medical schools, the National Black Nurses Association, and the National Association of Hispanic Nurses. Because one thing that there is evidence to show that when communities see physicians, nurses, researchers that look like them, they are more likely to participate in these clinical trials. And we've seen this in our own trials as well.
What are some of the barriers these groups face enrolling in clinical trials? Is distrust an issue here as well?
Definitely. Distrust is a main issue. And that is why it is so important that we make sure that our physicians and nurses look like these communities, sound like these communities, as well as another issue that we know is just lack of access. And so one thing that we've implemented in some of our trials is ensuring that patients are able to have transportation services, that they also have the possibility of having home health visits so that they do not need to leave the home, and then a simple lack of understanding of their disease and what a clinical trial is. So we've developed assets such as a website specific for a trial, explaining the disease to the patient, also something that their family can access to understand, well, what are the therapies available to my family member? And lastly, simple things like language translation services. They can be a help to some communities that language may be a barrier to understanding what therapies are available to them.
Driving diversity in medical research. Dr. Jennifer Jones-McMeans, I appreciate your time this morning talking with us. I was going to ask you, I don't know if you can tell us, but any big clinical trials right now going on at the lab?
Well, one of our big ones for peripheral artery disease, so that's think about the disease of the arteries outside of the heart, is our Life BTK trial. So life-btk.com is the website. And that is to evaluate a new therapy. We're working with the FDA on this to treat this disease below the knee that can be very devastating, especially to people of color.
Definitely very important. Again, I appreciate your time, Dr. Jones McBeans. Have a fantastic holiday.
You as well.
I love when we check in with our other states.